What is akathisia? My name is Dr. Ruth Doughton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And one of the things that has come up is asking for more details about akathisia, which is a possible side effect from a number of different psychotropic medications. So let's get into it. Akathisia is a movement disorder that's characterized by an internal sense of restlessness. And so this can present as rocking, pacing, fidgeting, which can cause things like irritability, anxiety, and significant distress. And in really severe cases, it can lead to SI. So this is not necessarily a harmless side effect. It can be potentially dangerous. So what causes it? Typically, we think of this as a side effect from antipsychotics, both the typical or the first generation antipsychotics like Haldol, Prolixin, Thorazine, as well as the atypical antipsychotics. So things like Abilify, Geodon, Lurasidone. However, it's not limited to these medications. It can also be caused by a number of antidepressants, including SSRIs like fluoxetine or escitalopram, as well as TCAs, things like nortriptyline or amitriptyline. Mirtazapine, trazodone, and Effexor can all cause this symptom. Even buspirone, which is an anxiety medication that we think of as being pretty benign, can cause this, as well as lithium, which is a mood stabilizer. There are also non-psychiatric medications that can cause this. So certain antiemetics or anti-nausea medications like Reglan, otherwise known as metoclopramide, as well as calcium channel blockers, and certain antibiotics like ciprofloxacin. And it could be both the initiation of these medications and or the withdrawal from these medications that can lead to this symptom. So what do we do about it? Well, the first thing you're going to do is try to decrease the medication if possible, or change to a better tolerated medication. Of course, this isn't always going to be possible depending on the patient and the risk versus benefits for their individual situation. So if a patient has to stay on this medication, or if they're stuck in this state due to protracted withdrawal, then there are a few things you can do to manage it. So a couple of medications that can be helpful would include things like propranolol, which is a beta blocker that crosses the blood-brain barrier, as well as benzodiazepines. Of course, sometimes if you're adding these other medications on, it can worsen things if there's a brain injury, or it could cause dependence on another medication, potentially just leading to another issue. There are also some behavioral strategies like walking, exercising, pacing, bicycling. All those things can help to get out some of that restless energy. If you've had akathisia and there have been things that have helped or not helped, then I'd love to hear about in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future offerings or courses or things that I want to be able to communicate with you all directly about. So if that's you, then send me a DM with your email. I promise I won't spam you. Wishing you all good mental health, and I'll see you in the next one.